speaker, Professor Raina MacIntyre. So Raina is a Professor of Global Biosecurity and Principal Research Fellow and Head of the Biosecurity Program at the Kirby Institute at UNSW. She leads a research program in control and prevention of infectious diseases spanning vaccinology, pandemics, bioterrorism, and emerging infections. She has led the development of EpiWatch, an AI-driven epidemic observatory that has proven capability in early detection of serious outbreaks. Raina has received many awards and is currently a member of the WHO SAGE working group on smallpox and mpox. Her first book, Dark Winter, An Insider's Guide to Pandemics and Biosecurity, was published in 2022. And so Raina will be discussing with us today pandemics and biosecurity threats.
Thank you. I've actually got some slides, which I think I need because I'm quite jet lagged. Let me just share my slides. So I think we all know about epidemics. We hear about them all the time. We've been through the COVID pandemic. They are perennial. There's actually an increase in the number of serious epidemics, and they have an acute disruptive effect on society, which is why we invest in pandemic preparedness. And they affect more than just human health, but they affect farming, the economy, and critical infrastructure. Japanese encephalitis in 2022 was devastating to our pig farming industry, and then bird flu this year has severely also impacted Australian farming, not to mention what's going on overseas with avian flu. But I'm going to move on to something slightly more slightly different to what you're used to hearing about, which is what keeps me awake, which is the quantum advances in genetic engineering and synthetic biology. Pretty much anything with DNA can be engineered, whether it's a human embryo or a plant or a virus or a bacteria. You can, there's, you know, research going on for the last 4 or 5 years, probably a bit longer, on engineering of super soldiers. And when you think about engineering of pathogens and engineering of human beings, that whole grey zone warfare area is kind of vastly expanded. Dual use technology occurs everywhere, you know, whether it's robotics or AI, but it's particularly relevant for biological research, and it's research that can be used for harm or for good. And there's you know, genetic engineering of pathogens, and there's synthetic biology, which means that we could be living in a Jurassic Park of viruses surrounded by man-made pathogens. And there's been a number of notable examples. You know, scientists were working on trying to create a SARS version 2 virus more than 5 years before the COVID pandemic occurred. And in 2017, Canadian scientists resurrected an extinct virus in a lab that is very closely related to smallpox, showing that you can actually create smallpox in a lab. And some Australian scientists 20 years ago accidentally created a related virus to smallpox that's 100% fatal and resistant to the vaccines. So you could use the same methods to resurrect smallpox and make it more fatal and more resistant to vaccines. And this is called dual use research. Unfortunately, the debate has really been around the rights of scientists and not about the existential threats that some of this technology poses, and the community really hasn't been aware of what's going on. Error and terror are the two ways in which an unnatural epidemic or pandemic can occur. And of course, biological terrorism and biological warfare have been documented throughout recorded history. The picture there is Sverdlovsk, which was the site of an anthrax leak, weaponized anthrax leak in the Soviet Union, that was covered up for, you know, more than a decade. The other factor is there's been a proliferation of do-it-yourself biology and biohacker labs. We've got biohacker labs in all major cities in Australia, and lab leaks are really common in top-notch you know, high security labs. So of course they'll also occur in these biohacker labs. But in addition to biohacking, there's also been home biohacking where people live stream themselves, you know, doing genetic engineering and so on. The other factor is the cost of this technology, like gene synthesis, has just gone down exponentially. So it's so much more accessible, and the open access methods on how to do a lot of this work, including synthesizing viruses, is open access. It's in journals for anyone to read. So like cyber threats, potentially nefarious biological technology has far outpaced our regulatory frameworks and threat detection. But I'd say biosecurity lags about a decade or more behind cybersecurity. And of course, the US is the only country that's really kind of got some start in looking at the threats and trying to do risk assessments, but the EU as well, but really not much at all in Australia. In the US in 2022, an illegal lab was found in Reedley, California. It was just a warehouse, and it was full of humanized mice and vials labeled Ebola and SARS-CoV-2 and hepatitis B and HIV. It has prompted a new bill to be proposed around legislation. But, you know, in terms of grey zone warfare, what an easy way it would be to do a Trojan horse attack where you set up a business that's making, you know, some kind of clinical tests, but is actually a biolab with weaponization being developed. So how do we find out about these things? Usually we find out really late, and that's a graph of the actual date of onset at the top of the COVID cases during the COVID pandemic in Wuhan. And on the bottom is the graph of when the WHO was notified, or when the health authorities were notified. So you can see there's a big delay. And we know already that by November, there were cases in November 2019, it had already spread to Europe, and by December it had spread to the US. So by the time, you know, we found out about it and were told it was a pandemic much later in the piece, it was too late. It had already spread. So I think we need to use early warning systems. We've got one we've developed here, which is an AI system called EpiWatch. We also look at climate data in this. We can map and visualize our epidemic data against a range of climate maps and look at the relationship of those to climate as well. And we do a pandemic watch to look for early warnings of a new pandemic. So I'll stop there, and I think the Australian Peace and Security Forum is a good platform to kind of raise some of these concerns and bring together different interests in the security of Australia. Thank you.
Thank you, Raina. And it really strikes me that this is an area with quite dire potential consequences that really doesn't have the same, or, you know, much sort of policy and work around response and what we can really be doing to address this. And I think equally perhaps has less awareness, even in just kind of the community domain and among people, of the extent of threats that exist in this area. So thank you so much.